to join us this morning. The fourth apology was Commissioner Mutupi. I know that that apology has been tabled, Chair, that she will be leaving at 11 o'clock. She has an interview commitment this morning. The fifth apology, Chair, that was sent, this written apology is Commissioner Deyi, who is also having a work commitment and will not be able to join the meeting this morning. So those 5 apologies are written submitted apologies this morning, Chair. Let me come back to the issue of the letter, Chairperson. The letter, Chairperson, that we received on the 31st of January 2022, Chairperson, also surprised us because that letter, Chair, was about the conversion of one commissioner. And the contents of the letter, Chairperson, are saying that I have looked at both commissioners, because when the submission was made, Chairperson, early last year, it was requesting, in fact, the first submission, Chair, that was made in 2020 after the resignation of Commissioner Smout. And both commissioners submitted a request for conversion, and that request was processed by the Office of the Chair, sent through Chair. There was 1 vacant position, 2 available part-time commissioners who applied for the same position. In explaining this controversy, Chair, I want to say that the response that came on the 31st seemingly was responding to the 2020 request for conversion based on 1 post of Commissioner Jennifer Smout. And that really surprised us, Chair, and which is why there was only 1 commissioner who was converted based on 1 post. Again, Chair, let me say the same thing that you said last year. When Commissioner Dr. Tlaleng resigned, then there were 2 positions. Same letters and motivation from the Office of the Chair was done, Chairperson, to the same offices to say that we have now 2 vacant positions. Can the consideration be looked at the fact that the conversions are for 2 part-time commissioners for 2 current vacant positions? And even in that letter, Chair, which was dated April, we did mention that the first position was Commissioner Smout's position, which was left vacant about a year ago, and then this current position, which was then April, because Commissioner Tlaleng resigned and left the commission in March 2021. So the letter that was submitted last year, March, Chair, indicates 2 positions that were vacant, and 2 commissioners motivated for those 2 positions. Later in the year, Chair, we wrote another letter requesting and making a follow-up to the same office's Chair, asking if that matter is being looked at, because we are running out of time. Can the vacant positions be filled? And Chair, the only response that we received recently on the 31st of January is this letter that says that the conversion is for 1 position. Which is why, Chair, immediately after receiving that letter, on the 8th of February, a letter was sent to the office, to the Speaker's office and the office of the President, to say that we do acknowledge the letter that was sent to us, converting 1 commissioner, Commissioner Mazibuko. However, the 1 position of Commissioner Mutupi has not been filled yet. Can the consideration be looked at in terms of filling that vacant position for Commissioner Mutupi, Chair? So that's the letter that was sent on the 8th. I'm sitting down here, Chair. I'm checking that letter that was sent on the 8th in terms of grammatical and spelling errors. This letter, Chair, I must say I can send it to you as well, and all the other letters that I say we sent last year. This letter that is before me, Chair, does not have grammatical errors. However, when we sent this letter, Chair, there was a letter that we attached, and that letter was Commissioner Mutupi's letter, because I wanted the office to actually look at the earlier motivations done by Commissioner Mutupi. And I do acknowledge the fact that, yes, there are a few grammatical errors in that particular letter, Chair. And I want to say that as we are in this meeting, I will be sending these letters. In fact, I will be sending this particular letter that was sent on the 8th, together with the attachment of Commissioner Mutupi's letter. And I will also be sending letters that I sent last year, Chair, talking about 2 vacant positions.
With the correction, Chairperson, of that, the letter in grammatical errors, right?
Right, Chair.
Yeah, ipale right, because manje, you know, your office is the highest office in the institution, so they won't take you serious. Ilungiseni nama dates kahle, and what happened, so that you send it again to the Speaker's office, so that Tina will fast track the process like what we did. Because
Yes,
it's going to delay us now.
Chair, I will do that.
Yeah, please.
Chair. In the meantime, I will send what I have so that you can look at it, and then we will correct it and we will resend today. Thank you, Chair.
Okay. No, thank you very much, Chairperson. We want to finalize this thing because we don't want to be bombarded with workload this year. We are trying our level best. You see, even now, we're trying to push all these reports which were there before us, and now it's like it's our responsibility, you know. And we've been given a deadline to finalize it. So I told Nelly Sagutu will do it next week, Wednesday. So next week, Wednesday, we know Fanega be vacant so that we finalize the last report. Unless we try to push, but it's not going to be possible, because from where we are at the parliamentary village, the buses to Parliament today for the sitting are leaving at 12:30. So by 12:30, it must be done. Yeah, but so it's not going to be practical. That's why I said we must start at 9. Okay. Yeah. So I'll try to call the IOSD so that all those letters, when they are sent to them, which they must forward them to a president as early as possible. Okay. All right.
Yes,
I have noted.
We will do our best.
Yeah, I have noted one apology. Yago Commissioner Day. Commissioner Day is all forever absent in the Portfolio Committee, Chair. Forever absent in the Portfolio Committee. You know, when I think of Commissioner Day, I remember last year there was something at his standing apology. I don't know whether honorable members, you remember it, or am I the only one who remembers it?
Chair, we do remember it. You are correct. In fact, last year we did have a discussion as well about it, Chair, noting the fact that our meetings are now mostly on a virtual platform. So for us members to have standing or commissioners to have standing apologies to these meetings. It was understandable, Chairperson, before when we had physical meetings, because it was an issue of traveling and accommodation for commissioners, which required logistics and funding. But for us, it does not really. It is a concern, Chairperson, for commissioners to continuously absent themselves from such meetings when there is better access than before. Thank you, Honorable Chair.
Honorable Sheriff, you wanted to say something?
No, Chair, I just want to agree with Honorable Masiko. I do absolutely remember it, and I still remember asking, what does a standing apology mean, and what does it look like? Thank you, Chair.
Thank you very much. What we'll do, we'll write to Chair, can you address it? And then in the next meeting, we'll have to take a decision. Because there's no way.
Chair.
Yeah. The next item. Neliswa, the next item.
It's presentation, Chairperson, by the CGE on the 3 following reports. It's progress report, transformation in the public and private sector. The next one is progress report on the state of shelters in South Africa 2021. The last one is on investigation into the choice of termination of pregnancy in South Africa 2021. Thank you, Chair.
Can you, CEO, can you start with the 1 year, which is number 2?
Sorry, good morning, Honorable Chair, honorable members. Number 2, the termination of pregnancy.
No, not that one. The other one?
The shelters.
Yes. I want you to start with the 1 year shelters because we are going to do an oversight visit. Shelters as the portfolio committee.
Okay, thank you, Honorable Chair. I'm just projecting.
You are doing oversight on our police station, Chairperson.
Correct, Chair. We are doing oversight on police stations in all 9 provinces, Chair. We are also doing oversight to the to Zella care centers, Chair. We are also within that also trying to do court monitoring visits. But I think we have covered quite a big ground in terms of the police stations in the provinces, Chair. And I must also say that there is a draft 6 months report that we are currently consolidating with the research unit. And we are continuing, Chair, as we also are going out as of today to provinces. We are consolidating the last 6 months. And when we are done with the last 6 months, Chair, ending in March, we will have a consolidated report of what the SAPS visits, monitoring visits look like. And this is the report, Chair, that we are hopeful that we will bring before you and also before the SAPS officials at high offices, as well as the portfolio committee responsible for security, safety and security. Thank you very much, Chair.
Yeah, and maybe what we want you to do for us is to send a list of the police stations that you have visited already, so that when we go and do the oversight visit, we'll check all the findings, things that you have found when you were doing your oversight, or whether there's improvement or no improvement as the portfolio committee.
That can be arranged, Chair. Thank you very much.
All right. Thank you very much, Chair. Over to you, CEO.
Thank you very much, Honorable Chair, honorable members, and my commissioners and colleagues. I just want to check if the presentation is projecting, just to make sure.
Yeah, CEO.
Thanks, Honorable Chair. This is a progress report on the state of shelters in South Africa, which is one of our latest report produced in 2021. Honorable Chair and members will remember that we had presented the initial report on the state of shelters. So this is a follow-up report in terms of progress made on the recommendations of the initial study. Honorable Chair, taking into consideration the time constraints as stated, I will just skip the preliminary introductory slides relating to the mandate, the legal frameworks that we follow, as this is the common information that give context to the work that we do to operationalize the work of the Commission for Gender Equality. So I will just start with the actual project itself. And obviously we had, as I have indicated, we had conducted the initial studies, provided recommendations, and these hearings specifically were following up on the recommendations that we had provided to different entities as the Commission. Honorable Chair, maybe just to preempt the presentation, I just want to say overall, as the CGE, we were encouraged in terms of the response to our recommendations, although there are still those areas where we still have gaps and we still need to follow up and report to Parliament, and also follow up on our recommendations so that different stakeholders can be able to work together to address these issues. I have described the purpose of the hearings, so I want to rush to the actual recommendations that we have made, mainly the progress following the recommendations of the initial study. Starting with the Free State Department of Social Development, these are the recommendations that we had provided to the department, that the shelters within the Free State are not functioning optimally, and the number of available shelters within the province was insufficient. We provided the suggestion that the department has thus far failed to implement the National Association of Welfare Organizations and the NAWONGO, in short, Judgment 1, resulting in costing model not being implemented for 11 years since the judgment, and that the current costing model does not show any progressive realization. We also had indicated that there were some untruthful responses in terms of the initial study, in terms of reasons for not funding shelters, with specific reference to the Goldfields shelter. We also had observed that the department deliberately, in our view, attempted to obscure the amount of funding allocated to shelters in its report. And as we followed up, the department submitted its progress report, and it agreed that the number of available shelters within the province was insufficient. And to address this, an amount of 500,000 was established for a shelter in Zarip for 2021-2022. Perhaps as a side comment, Honorable Chair and members, we can see the amount that to establish a shelter. I don't know if this amount was based on need, but it doesn't look like it's an amount that would cover what was recommended. And this is just a side comment, just looking at the amount. The department also agreed that with the finding they submitted that the department has since received additional funding with equitable and earmarked funding. As a result, shelters received increased allocations to address the progressive realization of their contemplated Nawongo judgment, as was indicated earlier. They also indicated that they had a challenge with non-submission of reports from the Goodfield shelter, which led to a concern that was there was mismanagement of funds. It was also indicated that the shelter refused to be funded, indicating that the funding from the department was not sufficient, including the delays in transferring funds. So it looks like there are still some, I will call it internal misalignment or disagreement, so to speak, in terms of the department and this particular shelter. However, the shelter has since been reinstated and the relationship with the department is restored according to our follow-up report. The department also indicated that on the day of the investigative hearing, it didn't have additional information. So that perception of untruthfulness and so forth was discussed and rectified. Now moving to the Northern Cape, we had recommended that they should establish a shelter in Namakwa. They must ensure the post-Marsberg shelter becomes operational, which was given a deadline as indicated there. The Commission would engage the Auditor General of South Africa, the Minister of Social Development, and other authorities regarding the major discrepancies on the allocation of funding between the National Department of Social Development and as well as possible auditing investigation of the discrepancies. Honorable Chair and members will remember that one of the critical findings of the initial study when we presented was the differentiated funding that seemed not to be informed by anything or scientifically calculated to justify why the funding was differentiated between provinces and between shelters. The recommendations also, we had said the departments must develop within 6 months effective mechanisms for accurately recording funding allocations to shelters. They should uniformly fund shelters. The department should at least offer a minimum wage to house mothers. In terms of progress, Honorable Chair, excuse me, I'm just sipping water. The Minister of Public Works initiated a process where her department is handing over building structures to the Northern Cape Department of Social Development, which can be used for shelters. The Northern Cape, 2 structures were identified in Kimberley. Honorable Chair and members, maybe if I don't give the details as they are presented there, but this supports what I was saying when I was saying we were encouraged as the CGE to see that our recommendations were actually, there was activity or there was a positive response towards some of the recommendations that we have made. So the department had a meeting as well with the NGO called Yedwa Safety Home situated in Springbok, which wished to establish as a shelter in the area. Also, in August 2020, the department had a meeting with the mayor's office in Namakwa municipality. Again, here we're talking about activity to try either establish shelters or improve shelters as per the recommendations that were made by the department. As we can see in the slide, The Department of Public Works was involved. They had allocated buildings to SAPs, but SAPs didn't seem to be using them, so they're working on allocating them for shelters. So this for us as the CGE is really showing that at least we are making inroads in terms of encouraging our implementing agents to take action in terms of our recommendation. This slide is still really talking about the issue of the DPW allocating buildings and, you know, just the detailed information, but also to indicate that 700,000 was also put aside for the establishment of the center, which includes the purchasing of furniture. Maybe I should leave out my judgments on the amounts and leave it to the commission. To Honorable Chair and Honorable members to assess that, so to speak. The Northern Cape, still on the Northern Cape in terms of progress. The department stated that they're still in the process of fast-tracking the operationalization of the Postmasburg shelter, which I had highlighted earlier as part of our recommendations. They submitted that the donor, the Columella mine, drafted a memorandum of understanding to be signed by the DPW as a custodian of public infrastructure. Again, a lot of positive activity happening there and getting funding from private entities. The department also developed the following mechanisms to record funding accurately. The one NGO managed shelter is based on its needs as indicated in the annual business plan and the available departmental budget. The operational costs are allocated into branches. So these are some of the, in terms of the allocation of funding as well, we are seeing some efforts being made in terms of business planning and actually allocating funding in terms of the needs of shelters. Honorable Chair and members, I must indicate we're not trying to paint a rosy picture. We're basically trying to show the positive, not necessarily implying that everything is well. There are still a lot of things that needs to be improved. But what is encouraging is that the department and its entities, as in shelters and stakeholders, are making an effort to correct what we had pointed out. They also have cited challenges with the fact that there is a lack of strong NGOs in the victim empowerment program sector. And because of this, the department had to take responsibility and ensure that shelter services are provided to victims of gender-based violence. And the province has 6 shelters that are operational, and 5 of the 6 are managed by the department. As we have indicated, the lack of NGOs in the province. They have also indicated that the offering for house mothers has been increased from 3,500 as per the initial findings, now to 5,000 per month, which I think was also a positive response to the recommendations. Now coming to the Western Cape. The Honorable Chair and members, if I can indicate here that perhaps I will try to summarize, as some of the findings between provinces are similar. Some are different. Maybe just try to highlight those are different between provinces. Where they are similar, maybe just skip and summarize the slide just to save a bit on time. In the Western Cape, the issues of persons with disabilities and the LGBTIQA communities were the main issues of concern in our initial studies. And these were our recommendations related into improving these areas of service delivery. And as the progress here, the department has submitted that it has funded the St. Anne's Home Shelter in the 18-19 financial year to build a ramp. The amount involved in this work is indicated there, 141,000. They also indicate that the Victims Empowerment Program Monitoring Team highlighted the need for a ramp at the Saki Bachman Center for Women and Children, which was also completed. I think, Honorable Chair, perhaps for us, if we are going to, or when, rather than if, when the need arises to follow up, I suppose now that we are in the easier stages of the COVID-19, would be to do physical visits to see whether these ramps that we are reading about here are actually there. For instance, also the program on 26 November, a partnership with disability sector to sensitize the sector on gender-based violence was available for victims and survivors. I will add, also there were also sessions. So these are like awareness sessions on issues of shelters. As we can see there, the stakeholders that were involved. So this for us as the CGE is encouraging, because you can see the relevant stakeholders are being involved in trying in the process of implementing our recommendation. The partnership with the disability sector was also to sensitize the sector on issues of gender-based violence and the services available to victims and survivors. And again, the stakeholders that were involved, including community health centers. Now coming to the Eastern Cape, the initial recommendations around issues of the funding criteria for shelters. Also, the criteria must be determined whether a shelter is properly funded without relying on the shelter's business plan. Department must share its action plan with the Commission once it was finalized, and the department must provide the Commission with feedback with the timeline provided. Progress in this regard, the department did submit the following criteria for funding shelters in terms of the policy on financial awards applied by the department, funding non-profit. So basically adherence to the policy, I would say, was restored for lack of a better word. The legal persona and registered in terms of the non-profit Act of 1997, and prove that the applicant organization had taken reasonable steps to apply for such registration, has proof of such application. So the registration in terms of any other prescribed service-specific legislation, such as the Children's Act, or the Prevention and Treatment of Substance Abuse. So these were some of the things that they are reporting to be rectifying at this stage. And in terms of both legislation, the service providers will, in addition, required to be accredited for rendering of statutory services. They provide service or intend to provide services for the people and specific communities in line of the department's priorities and objectives, these are constitutional imperatives in terms of the basic human rights of South African citizens. In terms of continuing on the progress, Honorable Chair and members, on the Eastern Cape, the department indicated that it was not able to comply with the recommendation from the Commission in light of the approval of the National Strategic Plan on Gender-Based Violence. These provincial legislatures are expected to comply and implement the National Strategic Plan, and these Honorable Chair and members will be for the Portfolio Committee to interrogate, but this is the information that was perceived to be the case in the Eastern Cape, and instead the Eastern Cape has developed its own integrated provincial plan for the implementation of the National Strategic Plan, which is a good move. Localizing national priorities, which require buy-in from all stakeholders, including government, civil society. So this for the Eastern Cape is an initiative that they are still pushing, but it seems like a good initiative to localize the NSP. Gauteng, our recommendation in terms of the sexual harassment policy, the Ikaya Letemba to review its policies, and also a proper breakdown of NGOs it works with and their staff composition with proper qualifications or skills breakdown. We also recommended that the IKL, the Ikaya Letemba, must conduct sensitization workshops around issues of LGBTI. They should develop standard operating procedures in relation to the intake and accommodation of the LGBTI community in their facilities in terms of progress. The sexual harassment policy in relation to the sexual harassment policy, the department has indicated that it has reviewed its policy in lines with the standard of and codes of the good practice and has attached, so they have provided to the CGE evidence of the reviewed policy. The IKL has indicated that in relation to the SOP, the shelter provides services for all victims. In terms of the standard operating procedure, the shelter provides services for all victims of gender-based violence, inclusive of people with disabilities and LGBTI communities. They also made an undertaking that they will review their policies to ensure that it does not discriminate based on gender. So some of the recommendation, Honorable Chair and members, there is still an intention to implement. Some have been implemented, and that's what I was indicating, that some things are happening, some are still need to improve. In terms of the request of a list of centers which works with Ikaya Letemba, that is the list as indicated there. The 5 entities that are listed. In terms of training, they indicated that the same will be conducted in due course. So these are some of the activities that are still planned, and with the understanding that there could be some form of follow-up in this regard from different stakeholders, including ourselves, the CGE, as from the context of being the watchdog, so to speak. Coming to Mpumalanga, we had made the recommendation for standard operating procedures and policies for admission to the shelters. We had information of we had requested information for the past 3 financial years in terms of bed capacity in every shelter per month, the number of family rooms per shelter, per substations, accessibility for persons with disabilities. And one of the findings of the initial studies was the admission of particularly male children over the age of 10. So these are some of the things that they have looked at. And we also recommended a code of conduct in the shelters, sexual harassment policy, the skills program offered in shelters, allocation of funds. So it's pretty much, these are the recommendations that have already been presented, including the questions such as why was there no consumer price index related to the increase from 2018-19 to 2020 for these shelters. So that kind of financial analysis, the question was there. The progress in terms of responding to these recommendations, there is an operating procedure followed in every shelter. Before a person can be admitted, there's a screening by completing form CW2. Afterwards, if a person is admitted, CW5 is completed. So you see a procedure that now is being implemented, which when looking at this information implies that something formal has been established in terms of standard operating procedures. On planning and contracting with social workers, planning and contracting, the social workers play a role. The intervention phase is where psychological services are rendered to compile a report. This is followed by the evaluation on progress on all services rendered. Reports must be compiled. I think this is just a part of the standard operating procedures, just for the summary of this presentation. A policy on admission of victims in the VEP facilities that is used by all shelters in Mpumalanga is in place, and the policy obviously is designed for the protection of victims in relation to comprehensive care, I will call it, because it lists all kinds of different services that are provided. Continuing progress on the Mpumalanga DSD, the development of the code of conduct requires that the shelters adhere to accessibility, confidentiality, safety and security, and there are strict monitoring and adherence by department on shelters. So this is one of those positive improvements that perhaps a subsequent work needs to just look at the effectiveness and efficiency of these procedures that have been established. The department also submitted its sexual harassment policy as was recommended, and the policy was approved in 2009, which says to me, Honorable Chair and members, that some of the information that we didn't receive during the study, the initial study, might have been there, but now on follow-up, if you look at when the policy was approved, you get the information, and that speaks to those limitations that we always mention, that sometimes it becomes difficult to get the information that we request, and the policy clearly sets out the types of behaviors. So it does have a code, so to speak, how to behave, and how the service healthcare providers and service providers in this regard need to conduct themselves with the recipients of their services. The department is offering skills programs, and there is proof that they are accredited. The programs are offered in shelters. Only certification, the programs, the skills program offers, and they give a certification, completion certification for the program, and these are listed there are some of the skills that are provided in these skills programs provided to the residents of the shelters. and this followed the allocation of funds to the Grip Mkonto shelter that is unregistered at this stage as an extension of Grip Nelspruit and operates under NPO registration as Grip Nelspruit. The department has also developed a monitoring tool to monitor objectives of shelters. In terms of funding, the Mpumalanga Shelter Movement SA received 1.8 million because it has offices in 3 districts, and the districts are listed there. We go to the northwest. We had recommended the cost center model and the equitable share should be studied in detail to ascertain whether it works. It works out fairly for all shelters. The department must provide a plan with proper timelines on how the late payment of funding will be addressed so that shelters and intern survivors are not adversely affected by the inefficient way of managing budget allocation, so to speak. In terms of progress, the Northwest Department indicated that it facilitated the development of a draft integrated Northwest Provincial Gender-Based Violence and Femicide Response Plan, like the Eastern Cape. This is one of those good things, but then I suppose monitoring should happen in terms of effective implementation of these plans. The response plan is derived from the National Strategic Plan on Gender-Based Violence. Again, the issue of localization, as I was mentioning with the Eastern Cape, the plan guides stakeholders on the provision of the services and obviously follows existing common laws in the country, which is very key in terms of the provision of services provincially to align with national priorities, not only program priorities, but also financial priorities. Gauteng, the recommendations, the department should review its funding model and budget allocation. Again, these were like some of the common recommendations that we had made to different provinces, reviewing of guidelines, sensitization around issues of LGBTI communities, issues of the reviewing the costing budget in relation to subsidy of women and children accommodated at shelters, provision of the reviewed costing within 30 days upon issuing of the report, the initial report, and progress in terms of Gauteng. The department has indicated it has funding model, but the budget allocation has been inconsistent and shelters are not funded equally. So it looks like the challenge we had identified persists. It has developed a model which will be effective from April 2021. So there is a plan to improve that, which from where we are sitting, for me, it's
Yebo. Unjani?
Honorable Chair, may I have your protection?
Who's that man? One man uphazamisa CEO.
Okay, thank you. Okay, I was in the second bullet that the department submitted that the shelters in Gauteng have their own accommodation criteria for children and boys that are over 12 years. And again, Honorable Chair and members, I keep going back to the same point that some of the progress reports that we have an imperative for further follow-up, just to verify that all these plans and activities are implemented effectively and are indeed there, they exist. And it was also submitted that in Gauteng there are 22 shelters and only 2 have a family unit which can accommodate children. Yeah, which sounds like something that needs to be looked at if you have 20, the whole of Gauteng have 22 shelters and only 2 can accommodate children. The schedule sensitization training of staff to adequately sensitize on issues of LGBTIs communities has indicated that the department had embarked on a capacity building of staff and non-profit organizations. And then obviously one could just summarize by say awareness raising campaigns are in progress on issues of LGBTIQ. They indicated that some beneficiaries are not comfortable sharing rooms with transgender and asexual persons, but these are the prejudices that prevail in society that requires continuous sensitization on people's equal human rights, regardless of who they are, so to speak. But those things will still exist. The costing model has been reviewed, adequately provides equal opportunities in relation to the various shelters, and this addresses the inconsistencies that were picked up in the previous study. The department has further mentioned that in terms of its guideline, it does not accommodate someone at face value. The provisions of the guidelines do, however, speak directly to a person's sex and not necessarily gender, which may have to be reviewed to ensure that they are gender sensitive. As we know, when we talk about LGBTIQ plus communities, things are not black and white. You can't just say it's male, it's female. You need to substantively analyze how people identify themselves and accommodate that. The National Department of Health, in terms of the recommendations, we had recommended the issue of the standard to develop norms and standards for the provision of services to domestic and gender-based violence survivors. That is the creation of an area-relevant shelter referral, sensitive treatment of survivors, and required services for survivors. So this is basically norms and standards for the services provided to survivors of gender-based violence, transport to health facilities, clear sensitive norms for the provision of services to LGBTIQ plus communities, to issue a circular by the end of December 2019 on the prioritization of GBV survivors at health facilities at all levels, and a copy of the circular was provided to the Commission. So that is just a positive response within the recommendations that we had made. In terms of developing a program on harmful social norms that facilitate the spread of GBV, this was one of the recommendations. And if Honorable Chair and members remember, these are some of the recommendations that were made in the IRAP report, excuse me, including the duty to educate communities on issues of health, also to partner with SAPS to develop a shelter referral list at health centers and ensure that these are kept in a safe place, meaning perhaps accessible to the relevant people who need to use them. In terms of progress, the department indicated it received a national shelter list. It also indicated that they're receiving attention from it. So they got the list and they're giving it attention. The Department of Social Development and SAPS also advised that they held meetings in October 2022 to plot health facilities against the national list using the referral system of the SAPS. so that stakeholder collaboration, relevant stakeholders who have common goals collaborating to respond to the recommendations. I was referring to these kinds of interventions. The required services for survivors and their children at shelters and studies of care of the National Department of Health advised that it has developed guidelines on the management of PEP, post-exposure prophylaxis in occupational and non-occupational exposures. The prioritization of survivors of GBV in clinics and hospital, the department, and this is the National Department of Health, is still in discussing a circular which will alert heads at Health Department in provinces that survivors of GBV should be prioritized. So this, we saw the circular was developed in response to the recommendation. Now this indicates the circular is being implemented, so to speak, and the transport for survivors to health facilities and the provision of primary health care at shelters. The department advised that it had convened a meeting between the National Director of Emergency Medical Services, the EMS, on transport for survivors of gender-based violence. I think it's for us as the Commission, some of these progress reports, to note the progress report that says we need to still go and see that things that are still being implemented, eventually they would be implemented. At the meeting, it was agreed that the Director of EMS would table GBV to the National Committee of Emergency Medical Services, amongst other things, prioritizing GBV survivors, healthcare facilities at all levels. So this is basically saying this recommendation is also receiving attention. The department to make mental health services as well as detoxification facilities more accessible to shelter residents, and they will revert with a proposed rollout plan in this regard. In this regard, the National Mental Health Policy Framework and Strategic Plan 2014 to 2020 identified, I will say, and refers to violence and crime as one of the key determinants of mental health and mental illness. So this, in a sense, one again is saying, at least now you see attention to the nuanced aspects of gender-based violence, including mental health services and the factors contributing to mental health, including gender-based violence. Continuing the National Department of Health, the progress, the department must provide a report on the training that frontline staff, managers and senior managers have received on GBV. Criminal Law, Sexual Offences and Related Matters Amendment Act envisions criminal justice system that is managed by skilled and competent healthcare professionals. So here, just alluding to some of the legislative requirements that informs not only the CGE recommendation, but also how the departments and its subordinate departments should be providing these services to communities. The comprehensive healthcare is paired with educational information, IC material, public announcements. So this is in terms of educational material. That recommendation about enhancing community awareness around this situation. So just to sensitize communities and to make them aware of services that are provided. The department's work is also extended through funded partners such as Love Life and all these entities that we are familiar with, mainly across the provinces. You will find your Soul City and so forth. The South African Police, our recommendation here had included that they must submit the National Instruction on Domestic Violence that will have a requirement for commanders to ensure that members dealing with domestic violence are not perpetrators themselves. They were supposed to submit to the Commission the audit report by the United Nations Women's Delegation on the SAPS Gender-Based Violence Training Manual, which again, these were given timelines of about 2 years back at this stage. We also recommended that all members who assist victims of sexual offenses undergo specialized training on GBV. This must be done again by August 2020. Honorable Chair and members, I want to expedite this slide as I had indicated earlier, and I hope this is okay. Some of these recommendations are not only, well, they were presented, but they are also common to some of the outcomes, the findings of the IRAP study. And it's interesting that when you see the response here and the response in IRAP, one can begin to wonder how things work. But in terms of programs, progress around the SAPS, the Instruction 7 of 1999 on domestic violence has been amended by consolidating Notice 15 of 2020 and a copy of the amended National Instruction. And this was submitted to the Commission. The SAPS also submitted that it's yet to receive the audit report, despite submitting and allowing the UN access to evaluate the material. So this is like an external factor affecting an expeditious response to this recommendation. SAPS also submitted that due to COVID-19, it could not commence with providing the specialized training on gender-based violence. And in the same light, they made a firm commitment to provide the training as the COVID national regulations allow, and as they are beginning to allow for mass gathering. National Treasury, the recommendation we had provided included that the Department of Social Treasury and the Department of Social Development must develop a standardized shelter funding procedure. They must also develop a consistent budget allocation, administration, and minimum standard requirements for shelters. Treasury and DSD must provide the standard and adequate resourcing of shelters nationally, and the two departments must also consult with relevant departments and elevate shelters as a sub-program to monitor compliance. As Honorable Chair and members will remember, this was one of the biggest findings, the unequal allocation of funds. We also recommended for them to conduct training for their employees. Treasury should hold departments accountable for failure to adhere to regulated governance practices and failure to account for where misspending is known. Treasury and DSD should keep data to track the number of persons or shelters that benefited from their annual allocations. Lastly, the recommendation was that Treasury and DSD must develop minimum standard policy at national level, providing for the needs of persons with disability, the LGBTI community, LGBTIQA+ community, and accredited skills development programs for survivors at shelters. In terms of progress for National Treasury, as per the response for the Treasury addressed the CGE, it was advised that the Department of Social Development is responsible for oversight and support of shelter programs. Therefore, budget and allocation to department and programs is and has always been informed by departmental plans and resources available. It was asserted that the DSD is responsible for policy and implementation of victim empowerment programs. The recommendation to CGE was that it is the DSD which is placed in the best position to provide a progress report. The Limpopo Department of Social Development, we recommended for them to speed up the process of accrediting its skills development programs, that they must urgently finalize sexual harassment policy. And I think these are common with one of the departments that I have already presented. So I think I will also skip to the progress report, as the plans and all that. These were given timelines for submission to the commission. The progress, the Limpopo Department of Social Development is in consultation with the National Department, DSD, to have the skills development offered in Kuselega One-Stop Center accredited. The process of accreditation is lengthy. So just explaining, maybe in summary, one could say the department is reporting that it is taking action, so to speak. And the department also say they are in the process of engaging the local FET to enter into service level agreements. As things stand, they have no capacity to offer the programs on its own as a department, hence the effort to use specialized institutions as FETs to assist. So in this regard, one, in terms of progress here, sees the willingness to implement the recommendations amidst minimal resources. The department is here to develop the sexual harassment policy, stating that the draft was supposed to be consulted with Limpopo Chamber, Public Health and Social Development Sector Bargaining Council. So these are just some of the issues where work intention to action the recommendation is there. Some is in progress, some is still being explored. If one reads some of these progress reports, especially this one. In terms of establishing new shelters, the department indicated due to inadequate budget to build new shelters, it approached the Dpw in the Limpopo to assist with the identification of unused government buildings that can be used. Thus far, it is affirmed that identified buildings are in Lulekani, Mopani district, and as listed there, those areas. So for me, some of these progress reports, the key takeaway home is something is being done, buildings are being identified. We just have to keep monitoring how far this work is going. So these are some of the situations that have been put in place. Then they identify the construction of the 30 beds on 1 March 2022. So those are some of the victim empowerment, the shelters that are being earmarked for establishment, so to speak, as detailed there. So this for me looks like at least good work with numbers to show what has been committed. Whether the money is enough or not, it's another question, but there is work that is being done, and it just needs perhaps encouragement, redirection, advice, and so forth, for it to actually ultimately benefit those who are using the services. The Dpw and Infrastructure, our recommendation had included that a comprehensive and final report be submitted by March 2020 to the Commission, the DG to write to provincial heads to make properties available for the program, the department to provide a list of the types of buildings to be allocated for shelters. In terms of progress, the department wrote to the provincial heads, as was indicated, to make properties available for shelters to be established. The Minister of the Department of the Dpw and Infrastructure did, however, hold a virtual meeting with provincial NECs and HODs of social development and public works to make properties available for programs by 1 June 2020. And the minutes of the meeting were shared with the Commission. So this is interesting work where I think it will help us as the CGE perhaps and other stakeholders to see how far this has gone. Again, the DPW submitted that 54 buildings have been identified in all provinces. To date, some of the buildings buildings were renovated. 6 properties in Gauteng, 6 in the Western Cape. Lease agreements of the said properties were being finalized. And again, Honorable Chair and members, if you allow me, this is the work of the DPW, just to show that there is a good response, so to speak, as detailed in this slide, without going through it verbatim. Human settlement, just to recap the recommendation, to finalize their special needs housing policy. The deadline was given there, including the guidelines for implementation, to consider liaising with the National Shelter Movement and the CGE on the issues of shelter, to submit the draft special needs housing policy to the Commission. In terms of program, the progress, the special needs policy has been drafted and was supported by executive management of the department. We, as the Commission, we await confirmation of the approval by Cabinet to support commitment, so to speak, as the policy is currently draft. So this is good progress. The department has compiled has complied after the hearings. A workshop was held on 15 January 2020 and presentations made on special needs housing, which has GBV as one of its categories. Continuing on progress on the DHS, engagement held by the department was to prepare a memo for the Minister for the submission and adoption of the special needs policy to the Minister and members of the Executive Council, and possible presentations at Cabinet. The Department of Social Development, recap of the recommendations. They were supposed to provide a draft sector funding policy. They will also finalize and approve a policy to be finished to the CGE March 2020, identification of 3 existing sectors, shelters to pilot the LGBTI QA+ friendly model. The wording must be refined to be inclusive and not discriminatory. Where language becomes, the language in terms of how we label people becomes, can facilitate discrimination, as that's how we perceive people. In the recommendations continuing, to provide an intersectoral policy once it's finalized, provide information on Reapila Safe House, which is in the Free State, also to provide disaggregated data in terms of race, gender of the 200 social workers. Excuse me. The model for victim empowerment program, the implementation plan for the Nawango judgment, information relating to the standardization of minimum wage across the shelters, department to request more funds to implement the Nawango judgment from provincial treasury level. Progress. The department has provided the sector funding policy and as recommended by the Commission. In terms of monitoring the implementation of the policy, the department indicated that in the past, transfers to non-profit organizations and other entities have not been managed transparently, which has changed in order to ensure accountability for allocation and use of public funds. The publication of information relating to transfer is an essential mechanism to improving transparency and accountability. The statistics submitted by the department reflect the number of social workers recruited and different provinces deployed. The department indicated in their submission that it has secured funding for the appointment of all the 200 social workers. Funding will, however, reflect in the 2020-21 allocation, which should be out by now in terms of follow-up. In terms of the department hosting national and provincial consultative processes, the Commission is aware that the national DSD has embarked on various consultative processes in provinces to develop an intersectoral shelter policy for victims of GBV. In conclusion, Honorable Chair and Honorable Members and my Commissioners, the Commission for Gender Equality is encouraged, as I was saying in the beginning, by the public sector willingness and commitment to serve victims of gender-based violence in terms of ensuring that they have sufficient shelter to accommodate them, particularly those with different types of abilities or disabilities. There are provinces that established additional measures to establish shelters post the engagements with the Commission, and this includes the Free State with additional shelters, the Northern Cape, where a budget is also established. So there were some extra mile steps taken to ensure that services are improved. There is, however, a continuous exclusion of admitting boy children over the age of 12 in various shelters, where their exclusion is not justified in terms of our conclusion as the CGE. The provincial departments could not submit their GBV action plans pending approval of the National Strategic Plan on GBV. Provincial legislatures, I think this is where people in provinces are like saying this process should take place before we can do this. So in terms of their localizing of the NSP, they still cite what should happen in terms of provincial legislatures, the national NSP, and so forth. Thank you, Chair. This is the end of the presentation.
CEO.
Yes, ma'am.
Yeah, you can present the second document.
Gonjo,
what is the second document?
The termination. The Termination of Pregnancy Act, or the transformation in the public and private sector.
Transformation
Okay.
of the private sector.
Wow. Bear with me, Chair. I'm sorry. The reports. There we are.
Gender transformation in the private and public sector. Yeah.
Thank you, Chair. This is a study, the latest, so to speak, report on gender transformation in the public and private sector, conducted by the Commission. And again, Honorable Chair, if you allow me to expedite by skipping the introductory slides on the mandate and the legal framework.
Yeah.
And go straight to the actual work. The study, the transformation hearings were conducted in 2019-20 in Gauteng. The 4 entities were subpoenaed to appear before the Commission and account on compliance with the Employment Equity Act and other gender-related legislation. And the entities that were subpoenaed were Vodacom Group Limited, Woolworths Holdings Limited, National Department of Cooperative Governance, the National Department of Justice and Constitutional Development. So a questionnaire was dispatched to the entities. Then later, the responses after analysis of the information that was submitted, the entities were then called to come and discuss. So both qualitative and quantitative research methodologies were used here in terms of the information that was requested. Basically, the CGE is concerned with the lack of proper understanding of gender dynamics in the workplace, accompanied by a slow pace of transformation. Females and persons with disabilities are underrepresented at top, senior, and middle management levels of entities. The underreporting of sexual harassment cases is a cause for concern for the CGE. And furthermore, the buildings that are not conducive or accommodative to persons with disabilities. So this is like an overall situation that we observed, that we feel we are not doing well, both in the public and private sector around these issues. So these represent a low level of compliance with relevant labor legislation aimed at transformation, more specifically the Employment Equity Act, the BCEA, and especially PEPUDA. So I think we make this point because as the Commission, we like to highlight that non-compliance is not simply non-compliance. It's actually contravening the laws that we have put in place. We are not just disadvantaging those who are expecting our services, but we are to a certain level breaking these laws. So we do emphasize that so that it is clear that when we talk about issues of gender equality, it's not something that is just out there. It's supported by the Constitution. It's supported by our national law, which is based on the principles of a non-sexist and non-racist society. So we made a decision to place special focus in the private and public sector because of the lack of transformation in both the sectors. But this included, amongst other things, the sexual harassment cases lodged with the Commission. So these are some of the issues that motivated us to conduct this investigation and also call the hearing for this entity to account. Reported cases in the CGE, the slow transformation around issues of LGBTIQ+, as indicated in the other report, the placements of women and persons with disabilities in senior management, and also the adoption of gender policies and the inaccessibility of buildings in some of these entities. So the objective of the hearing, really, I think I have pretty much touched on this as I was explaining why we called these entities to account. In terms of the findings with Vodacom, again, what I like to call the apartheid picture is still visible, where white males dominate at the top. And then you have also an underrepresentation of women generally in managerial positions. The entity, though, created an enabling environment for the needs and challenges of women and persons with disabilities. More men have been promoted than women and various occupational levels since 2017, and the adoption of flexi hours and establishment of medical units for women employees is best practice. So you have those embedded cultural or patriarchal aspects of the company being predominant, and then you have other aspects where the company is making an effort to change things. And as well at Vodacom, there was a prioritization of gender mainstreaming through the adoption of gender-related policies, such as the code like girl intervention and gender-neutral bathrooms, including various trainings. However, it was found that the policies are not really gender neutral. It's one thing when a company shows the willingness to develop, to mainstream gender in their policies, but here one has an understanding that this is not a simple task. You need to understand the gender dynamics, whether historical, psychological, spiritual, all aspects of gender dynamics to be able to make a policy gender responsive. So a lot of companies or a lot of people, both in the public and private sector, need support in terms of making their policies to be responsive instead of being neutral or silent about issues. There was a disproportionate investment in women. For example, programs it offers in conjunction with the Gordon Institutes of Business Science, GIBS as well known. They were working with GIBS programs, but it is spotted that once the pool for talent is created, measures should be adopted to ensure that this upward mobility for these women in the workplace is actually taking place, because it's one thing training women, and it's another actually putting them in the relevant posts where they should apply their skills. And maybe I could add that also the notion that women don't have skills need to be interrogated, because there are skilled women out there, and that women are not empowered shouldn't be a reason to say that's why we don't have women in the relevant positions. The recommendations to Vodacom was that they should increase the representation of women in top and senior management positions. There must engagement should be conducted between the CGE and Vodacom on sexual harassment by March 2020. Vodacom should assess organizational culture and how it affects women, and accordingly develop a culture change strategy on the outcome of the audit. All employment policies must be gender neutral. And I have indicated that some of these companies need support in that regard. A progress report on the findings and recommendations. The entity, meaning Vodacom, submitted that the information and technology sector in both emerging and first world countries, is dominated by male, more especially engineering and technology side of business. However, the entity is making serious strides to address this imbalance by introducing several pioneering programs to ensure that women emerge as leaders in this area. Basically, it's saying traditionally around the world, ICT is predominantly occupied by men, and they are trying to do something about that to bring women into the picture. They consider that the representation of women remains a challenge for the business and the broader telecom sector. In South Africa, women account for 42%, almost 43% of the workforce, with 34.3% at senior management level against the target of 36%. And these statistics, one will see, depending who you're talking to, different companies, we will see a different picture. But what remains is, as a country, we are striving for gender parity at the end of the day. The progress report again from Vodacom, they indicated that in top management, there has been an improvement in the representation of African people. The entity commits to fully exploit the EE drivers, appointments, promotions, and so forth to facilitate progress. Therefore, its key focus will be on recruiting women into top senior and middle management positions. And this is where I say these promises obviously mean we still have a lot of monitoring work to do. They indicated that achieving gender balance continues to be one of the company's 5 strategic pillars adopted in the Vodacom diversity and inclusion strategy. Vodacom plans to improve gender balance through programs such as the Vodacom Advanced Executive Program. So Vodacom seems to have some innovations, so to speak, in place to try and respond not only to our recommendations as the CGE, but also to the national picture, if you like. So in terms of following on the national priorities to promote equality in the workplace. The Harvard Senior Executive Program and Women in Leadership Program is one of the programs they have. Assessed that it has set targets to increase women representation and further identify opportunities for gender transformation. Remembering that we had made that recommendation that you don't only build capacity, but you also follow up on the capacity and utilize it by placing the people you have capacitated in the relevant programs. In terms of the issue of the engagement on sexual harassment, the said engagement did not take place as these commitments were made when the COVID-19 was just setting in South Africa and the whole world. So these studies happened around that time. And so some of the commitments to follow up, to meet and discuss and so forth did not take place. Mainly, many of us were taken aback and not knowing how to move forward until obviously we are now in the technological era. But as the CGE, we feel satisfied that the video clip used by Vodacom on sexual harassment is comprehensive and addresses key elements of sexual harassment in the workplace. So they have that system of television screens disseminating information around different issues, including sexual harassment in the workplace. So for the purpose of educational material, the CGE was satisfied with that. Regarding the issues of organizational culture, the Vodacom had identified the need for a shift in the company culture referred to as the spirit of Vodacom. So they come in with all these, what do they call them, value statements, so to speak, to try and implement their innovations in this regard. So in January 2020, they launched the spirit of Vodacom and articulated the connection between its purpose, strategy, and spirit. And the launch is known as the Big Conversation. That was attended by 259 employees across its market. So that for me sounds commendable. The survey will occur every 6 months so that the company observes progress made over time. What is this? The progress made over time. Spirit Beat will show where the company is making progress, or Spirit Beat is the name of their program, and over a period of time to measure whether there has been improvements, especially in terms of behavior change and business outcomes. Vodacom also, in terms of HR policies, they updated the policies to include gender neutral language. Amongst those reviewed are the following: the employment equity policy, so their internal policy, the sexual harassment policy, the flexi working arrangements, maternity benefits framework, parental leave. But to note, Honorable Chair and Honorable Members and my commissioners, is the policies were reviewed for gender neutral language. Hence, the point about addressing substantive issues may still stand, but maybe this is just as we improve, we begin to introduce new concepts in terms of how to improve on gender mainstreaming in policies. Excuse me. Coming to the findings for Woolworths, the results are pretty much the same as Vodacom in terms of the representation of women, and this is common generally in both public and private entities. So it's like this monster that we are fighting. So it's part of our transformation agenda anyway. So this work proves very critical if we are to really transform this society. The sexual harassment cases were finalized expeditiously and maximum sanctions imposed. So this is on follow-up following the previous recommendations. The Woolworths still does not have breastfeeding room, and most of its employees are young mothers. So this is one of those areas that needs to be looked at. Their blueprint for their new facilities include issues of PWD, which is persons with disabilities. The entities also introduced a gender-based violence task team to assist with social trauma that its employees must deal with outside the workplace. Maternity and uniform policy unfairly discriminate against LGBTIQA+ employees. The entity has a grievance policy which provides that the company has discretion to decide on formal or informal procedure when dealing with complaints. The recommendations to Woolworths was that they should increase the representation of African women and PWP in top and senior management positions. They should segregate data regarding the budget spent on individual employees to track spending per race and gender, and this for private companies that still have a historical picture of their staff composition. Tracking on spending per race and gender is very critical in terms of equal access to resources and opportunities. The company should also ensure that its grievance policy is time-bound regarding the finalization of hearings and cases. And I think this comment about informal and formal, of course, needs to be tightened so that everything doesn't become informal and people are marginalized along the process. The company should review all its policies and conduct training to all employees on the newly introduced or amended policies. They should provide action plans to deal with identified barriers and implementation. They should develop a plan to create breastfeeding rooms and conduct a feasibility study considering most of its employees are young mothers, to consult with the CGE regarding its plan on gender-based violence task team, or in conducting their programs that they intend to conduct. Progress in this regard, in terms of policy review, they've established a task team of functional experts to conduct a detailed review of its policies and procedures to ensure gender equality and that broader gender transformation is not compromised, which is a progressive move to get an expert. COVID-19 has slowed down some of the company's progress in terms of the deadlines that were provided. They have updated their grievance policy and implemented a stringent 21-day timeline for resolution of cases. So, and the policy has been shared with employees. So that again shows a positive and encouraging response, so to speak. In terms of the increasing women representation and persons with disabilities in top and senior management positions, the company has prepared an interim one-year employment equity plan, given the challenging and uncertain times its business finds itself in the context of COVID-19. And furthermore, the usual extensive consultation process on the plan and that identification of barriers proved difficult, and that perhaps the support, the necessary support is required, because as we report barriers and difficulties, marginalized people continue to be affected negatively. The company has submitted to kickstart a 5-year planning process in the current financial year, assuming this will be feasible within the macro context, and the plan will be aligned with the eminent legislation that relate to labor, the labor laws, let's put it that way. And regarding the budget spent on individual employees in respect of training, the entity will develop a tool to segregate the data, and together with the training policies, the timelines provided there. It will be interesting when we follow up. In terms of breastfeeding rooms, they tabled this recommendation with its real estate committee in terms of the investigating the feasibility of implementing this, and the company explored some options within its store environment that can serve as breastfeeding rooms, but this was placed on hold due to COVID. The action plan to deal with identified barriers. The Woolworths has agreed that it is in its consultation process to continue on focusing on the current barriers. Whilst there have been significant improvements in these barriers, they still require continued focus. So basically, Honorable Chair and honorable members, my commissioners, Woolworths and Vodacom, when we look at progress, one can make a similar comment that we made in the previous study, that there is a positive response, but we don't want to paint a rosy picture at the same time, because there is still a lot of follow-up work that needs to be done, and for some of these companies to be held accountable in terms of compliance with our existing legislation. In terms of consultation with the CGE, the company welcomes the opportunity to partner with us on this initiative, particularly in raising awareness on gender-based violence. So I suppose these are some of the relationships that we need to accommodate, provide support, or however we work with these companies. We don't only go and make recommendation and walk away. Where we can provide support, we need to, and I do know that we do that. We in some entities, we have helped them develop their sexual harassment policies, for instance. So that kind of relationship, resources allowing, we will continue to do that. The National Department of Cooperative Governance, the department fails to demonstrate commitment to transformation in its practices. Persons with disabilities were not represented in the top and senior management positions. The working environment is not conducive for persons with different forms of disabilities. So the findings are like pretty much similar. We'll see what happens. Here in the public sector now, the senior management posts are dominated by African males. So the trend continues. It's white, male, something else, and then Black women right at the bottom. So you see the pattern of patriarchy. The department does not have an employment equity manager as required by the law. The department does not have a gender responsive budget, does not have childcare facilities and flexi-time policy, no succession and retention policy, does not have policies to deal with relevant issues of specific reference to gender, disability, and LGBTIQA+ issues. So it's almost like all cross-cutting issues are not necessarily given attention when one looked at the findings of this study. We also found that the department does not take cognizance of Black people living in rural areas in its procurement practices, and women-owned businesses typically receive tenders amounting to 50,000 and below, which is not new. Actually, every study will show you that, which makes this finding valid. The recommendations that the CGE to meet with the minister to discuss the lack of gender transformation in the department. The CGE requires quarterly reports on targets set by the department. So this was almost like a close kind of monitoring requirement because the findings were not very good. The department to conduct a culture survey as well, regarding work dissatisfaction, sexual harassment, wellness, and so forth, and also issues of LGBTIQA and disability. They should develop and provide a plan to the CGE aimed at creating a working environment that is conducive for persons with different forms of disabilities. The recommendations also included appointing an employment equity manager, also to develop and source a gender responsive budget, to conduct feasibility study on implementing childcare facilities. So basically the recommendations are saying what is not happening should happen. As we can see, these recommendations are responding to the findings. The last two recommendations were to say the departments must take cognizance of Black people living in rural areas when it comes to procurement, and also try to allocate procurement activities to these rural people rather than keep them where they've always been historically at the lower scale of doing business. The department should conduct sexual harassment workshops. In terms of progress, the failure to demonstrate commitment to transformation, the department submitted that this is due to constraints in the compensation of employees' budget. Therefore, it's unable to meet government-wide transformation targets by utilizing the available vacant posts. In terms of PWD not represented in top structures, the department indicated that it will consider guidance in appointing persons with disabilities into the aforementioned positions. However, this will require the changes to its employment equity plan. The department also indicated that with regard to the conducive environment for persons with disabilities, they failed to provide the plan to address these issues during our follow-up. In terms of top and senior management being dominated by African men, the department highlighted that it will appoint the employment equity manager to deal with this finding. Currently, the department does not have the employment equity manager. In terms of the gender responsive budget, the department will consider allocating the budget. And Honorable Chair, honorable members, my commissioners, I'm now just providing the information as is. I'm trying to minimize my own comments. In relation to childcare facilities and flexi time, the department will conduct the feasibility study to implement childcare facility as guided by the DPSA frameworks. And no succession and retention plan was in place again. And in terms of procurement practices, the department undertake to play a role of supporting provincial and local government target suppliers owned by Black people, women in rural areas. Honorable members, you will see that there is a lot of work that still needs to be done in this regard. The evaluation criteria in transactions above 50,000 will include sub-criteria under functionality for points to benefit suppliers owned by Black people and women in rural areas without discriminating other potential bidders. Women, youth, and persons with disabilities participate in the mainstream economy through community work programs. These honorable members will know is a very massive area that is holding back transformation, so to speak. So a lot of substantive gender equality matters are embedded here, and they need to be resurfaced for them to be rectified. In terms of sexual harassment, the department submitted that workshops were held in 2017 and 2019. Workshops happened on 5. So this is the 22nd. Yeah, the workshops were held and last one, May 2019. The following policies were provided, amongst others: the Employment Equity Plan, Sexual Harassment Policy, Disability Policy, Wellness Management Policy, HIV Policy. And I suppose the question here is the gender mainstreaming in these policies. Now, the last department, Honorable Chair, members, my commissioners, the findings were that Black women are underrepresented. Again, the same story. The sexual offences court model does not make provision for breastfeeding rooms. The department delayed in handling sexual harassment cases without justification, and thus not creating a conducive working environment. There's a likelihood of underreporting of sexual harassment cases, and the department to conduct a survey on job satisfaction and sexual harassment. The department does not include people living with in rural areas, LGBTI and people with disabilities in its procurement practices. Honorable Chair, you will see that the findings are pretty much similar in across some between the private and public, between the public and private, and within each of the sectors. So it's basically what I think we have made a conclusion that there is a lack of whether it's lack of willingness, or shall we call it just the lack of transformation, or transformation that is too slow for what we are trying to achieve in 2030 and 2063 as a region. The department also didn't have flexi time in childcare facilities. The recommendation for them to increase the representation of Black women, let me just say these designated groups as informed by the findings. Also, they should come up with an implementation plan to deal with that, the issue of breastfeeding, the new model for sexual offences courts and maintenance courts, and there's the timeline given in 2020. The delays in handling sexual harassment cases should be addressed by policy and informed by best practices to create a conducive working environment. The recommendations, again, for them to conduct a culture survey, procurement practices must be revised, informed by the findings. The issues of the exclusion of designated groups in procurement need to be looked at with a very serious gender lens, because these are some of those areas where if there's no transformation there, there's highly likely for any other transformation to happen. The department should develop a skills transfer program and recognition of prior learning. In terms of progress on the findings and recommendations, the issue of representation of Black women in top positions, the department conducted a workforce analysis in February 2020, which was in preparation to review the Employment Equity Plan, which expired in 30 June 2020. The analysis revealed and confirmed the CGE's findings, the economically active population targets as provided by Stats SA, and also the targets are 36.2%, and African women were 27%. To address this, the department set 50% women target in its employment equity plan for July 2020 to June 2025, which was approved on 13 October 2020. So we see constructive response in this regard. Excuse me. The progress made as of January 2021 indicates an increase of almost 2% of African women at senior management level, which is also something to commend. Well, statistic is low, but the movement, I suppose one is looking at encouraging a positive behavior rather than focusing on negativity. But the movement is encouraging, but there must be follow-up so that a transformation is expedited. So from 28% to 29.9% in January. And also given the time frame, one would say this is not too bad. Breastfeeding rooms, the department submitted that the sexual offences court model was established with the objectives to create a victim-friendly environment where victims cannot suffer secondary victimization. They envisaged that in this 2020, the previous financial year, a pilot will be initiated and conducted. Regrettably, the outbreak of COVID-19, due to that, the exercise could not be put in place as planned. The delays in handling sexual harassment cases, the department assessed that it is currently implementing sexual harassment policy that was revised in 2015, which was benchmarked with other departments and fully aligned to the DPSA policy frameworks. The delay in handling cases was caused by a number of factors, which include the postponements going to sick leave by either presiding officers or witnesses, changing of employee representatives, and COVID-19 hospitalizations and isolation. The underreporting on sexual harassment cases, the department considers that there is that possibility and therefore commits to continue with sexual harassment training and awareness. The department appointed a highly skilled, trained and experienced official to deal with and investigate cases. The department further deepened cooperation with stakeholders and labor relations experts regarding training of employees, advice, handling and the proper handling and timeliness finalization of cases. The inclusion of people from rural areas in procurement. The department is convinced that a considerable share of its procurement expenditure benefited service providers in rural communities, particularly from its request for quotation processes. The department's RFQs is decentralized to all business units, magistrates' offices. The majority, of course, are rural areas, and part of its contribution to the promotion of local district economy, RFQs are always issued to service providers who are near where the department's offices are. But this requires numerical analysis to actually convince the CGE that this is the case. In relation to skills transfer department, the department says its inception of human resource development strategy since August 2018 has leveled the ground through its 4 pillars of encourage public-private partnership in implementing skills programs and the recognition of prior learning. Through its training arm, the Justice College, the department developed the Management Skills Development Foundation Project Management and Women in Middle Management Development Program to equip lower level employees to manage higher position. In conclusion, Honorable Chair, Honorable Members and my Commissioners, the Commission is encouraged by the private and public sector willingness and commitment to transform their workplace. As we have seen in the majority, there was a lot of positive response in some entities. However, the achievement of gender equality for women and persons with disability in both sectors remain a concern. Nonetheless, the additional measures such as adoption of new paid parental leave by Vodacom is commendable and reviewed as best practice that can be emulated in other sectors. The amendment of grievance policy by Woolworths to provide for resolution on grievance within 21 days. Again, it's something to commend. The COGTA made commitments to appoint the employment equity manager and the allocation of gender responsive budget. However, it is a concern that there are no time frames and the department did not put in place measures to ensure that the working environment is conducive for persons with different forms of disabilities. The CGE knows that the Department of Justice and Constitutional Development has put measures in place to address gender equality and transformation through its newly approved employment equity plan. Thank you, Honorable Chair, members, and my commissioners.
Thank you very much, CEO. Maybe what is the last one?
The last one, Honorable Chair, is the choice on termination of pregnancy.
You did a study on that one also?
Yes.
Okay, let's hear that report.
Thank you, Honorable Chair, honorable members and my commissioners. This again is one of our newest projects published in 2021. And again, Honorable Chair, with your permission, it's a very long presentation because we're trying to include as much detail as we can for honorable members to get a good sense of the study. So if Honorable Chair, I can...
It's a long report.
It's a long report, but I want to propose a way of summarizing it so that we don't have to go through all the slides. So firstly, Honorable Chair, if you allow, I will skip the usual introductory slides and just perhaps give a high level.
Let me check with honorable members if we allow you to make a presentation on that report, or you will present it with the other report. Can I get hands, honorable members? What do we do? Because it's a long report and maybe you have clarity seeking questions for the two reports that have been presented. Honorable Sheriff.
Thank you very much, Chairperson. I must be honest, I was waiting for this report because it's very interesting when we speak about the choice of termination of pregnancies. And I would hate for us to just rush through it and not deal with it extensively. So I would propose that we deal with it with the other report only so that we can have better engagement with it, because this is still a serious problem for young women in our country. Thank you, Chair.
Okay, thank you very much, Honorable Sheriff. Honorable Hlongo, what are you saying?
Thanks, Chair. As it said, it's a long report, and I think we should go into the two that were presented, and then when there's enough time, we'll deal with this one.
Okay, okay, thank you very much, honorable members. Let me get hands, CEO. That's how we're going to deal with it. Let's pack it. Let's deal with the two presentations that you have made, and then we'll see. And maybe to further report to the meeting that we are going to have next week, Wednesday. CEO. Honorable Carol.
Chair, good morning to yourself, members, and the CGE. I'm not sure whether is it time for us to have comments or questions. Can I get that from you?
Yeah,
Chair.
Yes, CEO first.
Honorable Chair, I think I would agree that we defer the report as honorable members suggest. Yeah, basically, yeah, I don't know if the commission would also advise on that.
On what?
On the defer, but the committee is deferring, so I think.
Yeah, yeah, we are deferring the report, yeah.
Yes, yes. Sorry, Chair.
Okay, no, it's fine. Let's get hands, honorable members, on the two presentations that have been presented to the portfolio committee, and we are deferring the last report to the next meeting. I will be noting your hands, Honorable Piri, Honorable Sheriff, Honorable Shongo, Ngobo, Babu Ngobo, Masondo. Okay. In that order.
And thanks, Chair. As I've already passed my greetings, I only have two things. One, it might be a recommendation or an addition to the transformation. Chair, the transformation report, let me start by welcoming all the presentations. They were so fruitful and helpful to us. It shows a better way to the CGE. One on the two private entities, which is your Vodacom, and the other one, I think it was Woolworths. The only thing that I want to add or request the CGE to add on their recommendation is that the same applies to the Department of Justice. There are no timelines, because if we can't put timelines, it will take forever for them just to say they need to have the transformation in terms of gender equity. But now we got a report. My suggestion would be the next report in terms of their follow-up. We need to know how far and the timeline that they have been given to make sure they adhere to the requirements. And as I move again to the first presentation, which is the shelter issue. On the shelter presentation, Chair, I've listened and realized it's only based on the government shelters or shelters that are run by government, but I want to take it back and get clarity or more information about shelters based on the experience or my observation from where from the point and the geographically where I'm staying in my province, in my area, municipality where I'm from. We've got shelters that I believe they are not taken care of, but I know they are private. They are owned by certain organizations, not the government. And those shelters, they are overcrowded. Those shelters, you don't even have programs of skills development, but mostly what I must put forward is that there are a lot of illegal migrants, but at the same time, they are still Africans and they are within our country. So I wanted to check with the CGE, what becomes their role in terms of those kind of shelters that are not adhering to requirements that we have outlined. There are requirements that they've mentioned, even in terms of health issues, in terms of skills development, and there's a lot of robberies and illegal issues that are happening in those shelters. Therefore, what is the role of the CGE together with ourselves in making sure those shelters becomes adherence to the requirement and the skills and what our government has put in place, or anything that is within our country must be regulated. So for me, I wanted that clarity. Maybe I'll take it from there if I get assistance from the CGE, and maybe even ourselves or other members will be understanding what must happen. That's the true shelters that I'm aware of. Even when we talk about the criminal activities, everybody points back to those shelters to say, we've got people who are staying there and there. And sometimes for them to eat, we need to go and buy them and request them to come and do our part-time job, and we pay them. So I feel it's not a fully fledged shelter the way as they're saying. I've went personally, tried to get information, but I believe it's not doing justice, it's not adhering to what has been presented to do. Thanks, Chair. Let me drop it there.
Thank you very much, Honorable Piri. CEO, are there any guidelines that are prescribed for AMA shelters by whether a Department of Social Development or by ESAPS? Are there any guidelines? Okay, can come in, CEO.
Yes, in the progress reports of the follow-up studies, we have found that provincially, some departments, the Department of Social Department, some have guidelines, some don't. But I think the National Department of Social Development, those are some of the recommendations that they have responded to in terms of guidelines, how shelters, especially around funding, uniform funding standards, uniform admission procedures, and so forth. And some had specific procedures provincially in terms of the standard operations in shelters.
Okay. Can you share those guidelines with us as the Portfolio Committee, CEO?
We will request for them, Chair. And I think some were submitted. We will do that, Chair.
Okay, thank you very much. Honorable Sheriff.
Thank you very much, Chairperson. Please forgive me for my video. My internet is so bad. I keep getting kicked out of the meeting. So I'm going to engage mostly on the first report on the state of shelters. The first thing I want to say is there's obviously an issue with the funding model. And it's great to see that the CGE has taken this up to ensure that there is a standardized model of funding and criteria that is given to shelters. A lot of the shelters that I visit or that I refer people to do indeed struggle with resources. So I hope that with this funding model that has been or is being created, that this will be assisted. Chairperson, I also want to speak about the NGO and management of the NGOs of shelters. I always think that this is a good idea because NGOs do God's work, if I could put it in a better way, and they have the necessary experience and the skills to be able to do the job properly. But I did note in the CGE's report that there was a lack of transparency when NGOs were involved. So I just want to find out, has this been rectified and what is the way forward? Chair, I'm going to move on to, I'm just going through my notes while I do it. In terms of the LGBT community, I think this is a massive one. Currently in South Africa, we don't have a shelter that deals specifically with members of the LGBT. And I understand that in the research, you had survivors that didn't feel necessarily comfortable sharing rooms with members of the LGBT. And this is really concerning because members of the LGBT are victimized on a daily basis. And oftentimes they find themselves on the streets because there is no safe space that will, give them shelter and a plate of food and help them get back on their feet. Chairperson, when I was in the city of Joburg, I was the chairperson for Gender, Youth and Persons with Disabilities, Section 79 Portfolio Committee. And, we did a stakeholder engagement where we went across the city and spoke to members of the LGBT community. And it's so disheartening and sad to realize how many members of the LGBT get put out of their house by their parents or their family simply because, that they just don't accept them for who they are, and then they find themselves on the streets. And so the shelters are so important to ensure that there's a safe space. So when we look at Ikaya Letemba, and the recommendation that it must ensure it does not discriminate against the LGBT, can I maybe just get some more information on where this came from, where this recommendation came from, and was there incidences that had happened where members of the LGBT were discriminated in order to do this? And then leading on to that, what is the CGE's thinking around establishing at least 1 or 2 LGBT shelters per province solely for LGBT, for members of the LGBT? And sure, I understand that I may be critiqued on this because we're talking about inclusivity and, being united and not separating or dividing people and shelters. But it seems to me that this might be the only way to start off with, by getting individual LGBT shelters that deal specifically with LGBT and resources that are dedicated to skills development, psychological assistance for trauma that they face, as well as getting back on their feet. So I just wanted to find out from the CGE, would they consider including this in their recommendations to make sure that there are safe spaces for the LGBT? I would definitely appreciate that, and I think a lot of people would. In terms of Pumalang, no, okay, that's done. Okay, in terms of the Department of Health developing a training manual to manage nurses and doctors on survivors of rape and sexual violence, what is the current status of that, and what's happening there? And in terms of SAPS, I mean, I understand that the UN Women collaborated with SAPS in looking at the training manuals, but they have not heard back from the UN. What is the update there? And is it necessary for them to wait on the UN before they actually implement or do something? Also, they speak about COVID-19 and not only SAPS, but also, I think it's, there was another department that spoke about SAPS, COVID-19, and that because of COVID-19, a lot of things has come to a halt. We have been in level 1 for quite some time now, and the regulations seem to be easing. So what is the update around that? Specifically, the commencing of training of SAPS. I find it so difficult because we've all become so accustomed to Zoom that I don't understand why they have to wait for COVID-19 to COVID-19 regulations to relax, when in fact this should have been happening already. The fact of the matter that GBV is such a massive issue in our country, the fact that this training hasn't commenced is a real issue for me, and I think the CGE must get more answers from SAPS so that we can understand it as well. Oh, it's Limpopo, looking at the progress with FET colleges for skills development. It was also put on hold due to COVID, and I just want to know if there's an update on that. Yes.
You can still come back.
Yes, I'm just going through my notes, Chair. So I think that's it. It's just for me, I think during COVID-19, I had a lot of women being turned away from shelters because of the regulations. And I raised this in committee, and I was hoping that the CGE would include it in their report, but maybe they can just do a follow-up and come back to us because that was simply unacceptable. And we found survivors and victims literally having nowhere to go during COVID-19 and having to stay with their abusers, which was wholly unacceptable, Chair. So I'll just leave it at that. My main issues are the LGBT training and the updates on what's been happening since COVID. Thank you, Chair.
Thank you very much, Honorable Sheriff. In fact, as CEO, I thought that your report will capture the issue of the families that are placed in those shelters, whereby they do have children. Some of the children have passed their matric and they are due to apply to the universities. Some have already applied to universities. But now when they apply for NFSAS, it becomes difficult for them to be approved by NFSAS. Their applications, the applications of those children are being declined. Why are they declined? They are declined because according to the requirements of NFSAS, the salary bracket of the family is at a certain level. And now when they are placed in those shelters, then there comes a problem. The fathers, they may be in those brackets that will make the child not to qualify for NFSAS funding. But the situation led to that child to be in a disadvantaged environment where now the child will be in a place of safety. So last week, I was approached by some women who are having those shelters, who are saying to me they are experiencing that problem. So as you were doing your visits, didn't you come across such challenges or problems that they may have been raised with you? And if they have been raised with you, so what do you think, what advice can you give to the portfolio committee, or what recommendations can you have so that, at least the Department of Higher Education should be aware of such cases, because I'm sure the system is designed in a way that it doesn't allow for those circumstances. And there's an outcry by those women who are having those shelters. And also, those children also are being affected by those situations. I'm not even sure how can we deal with that one. When it was raised with me, and remember, some of the parents were saying to me, in fact, their children, now they are threatening them to commit suicide, and which is something that I'm sure all of us will not find it to be okay, but it's something that as parents and as members of parliament, it's something that we need to deal with. And I'm sure even yourselves, you have come across those questions. So I wanted to raise this because at least you've done those visits. I thought that one way or the other, it could be captured in your report. And then my second one was, I know that you made a recommendation regarding funding of the shelters to the Department of Social Development. But what I want to check with you is that have you ever checked whether the recommendation that you have made to them and the policy document that they have drafted, is it benefiting those whether you say NPOs or NGOs or whatever, is it benefiting them? Have you ever reviewed your document since after your recommendation? Because what the Social Development Department have done, have drafted that policy, and whether in terms of implementation they've implemented it, I'm not sure, but that's what you can be able to present to us as CGE. Because when you make recommendations to people, you must also come back and have an assessment on what you have proposed. It's workable, it's doable, or there's a need for any improvement. Honorable Hlongo, I think you're the next one.
Thanks, Chair. Thanks to CGE and honorable members. Chair, mine is on the transformation in the public sector, private sector, I mean. I think CGE should also look at other sectors of the private sector, because I heard them speaking on Vodacom, Woolworths specifically. But then my question would be, do they conduct such studies on other sectors like your mining industry, forestry, and farms? Because I believe the transformation is far from happening, and also the wage difference is still a problem, especially between white women and Black women. But in mining industries, women are not there, or if you find one, you find a white woman. So mine would be, does CGE do such studies in those sectors of the private sector? Thanks, Chair.
Okay, thank you very much, Honorable Hlongo. And the other question is, have you presented your report to the Department of Social Development and the one for e-health department? So that, because it's important that when you do some research or some investigation, you need to also bring on board the relevant departments so that they are able to deal with issues pertaining to them. And next, Honorable Ngobo. Babu Ngobo. Honorable Masondo.
Thank you, Chairperson. Good morning, honorable members, CGE, and our officials. In the first report, I just have a question. What progress has been made since the CGE last presented to the committee on this report? What challenges has the CGE experienced in the development of the report and with the implementation of the recommendations? What has the CGE proposed to Vodacom in its bid to create employment policies that are gender neutral? In terms of COGTA, the report noted that the department failed to demonstrate commitment to transformation in its practices. The department submitted that due to constraints in the compensation of employees' budget, it is unable to meet government-wide transformation targets by utilizing the available vacant post. How is this justifiable? Thank you, Chairperson.
Thank you very much, Honorable Masondo. Honorable Mpiti. Okay, I think when coming to presentation number 2, my question will be the same, CEO and Chair, that with regards to this gender transformation in the private and public sector progress report 2019-2020, have you also maybe presented your document to the Department of Women and Persons with Disabilities regarding the findings. Because of the same views that I've raised, I think it's important. And then the next one will be you have noted in your report, CEO, that transformation, gender transformation in the private and public sector, it's very slow. So what are you intending to do so that the implementation of your recommendation is being fast-tracked or it's being done with speed? Because if it's slow, it's not going to bear fruits, and it's not going to benefit our people. So you know, just noting it in your report or making a recommendation which it shall not be implemented, it will be like a fruitless exercise. So it's important to then come up with another strategy on how are you going to ensure that private sector and public sector, they implement your recommendations holistically with speed. Because once it's not taken serious, I think this goes back to the issue of us not having a policy that will oblige everyone to implement gender transformation as fast as possible, the way we expect it to be done. I think it's time that you need to also, when things are not done according to your findings and your recommendations, something, plan B, you need to have plan B on how are you going to ensure that your recommendations are taken serious by everyone and they are implemented. And just fast track and have a team who will fast track all those recommendations that you're making and check whether they are being considered or not considered. If Honorable Mpiti is not yet back, then I can hand over to the chair and the CEO. Chairperson and Deputy Chair.
Thank you, Chair. I will start, and I will allow Deputy Chairperson to come after my responses and see. Chairperson, the first question, I'm not sure whether it was asked by Honorable Piri or yourself, Chair, on the by DSD Chair. And I had my hand up earlier so that I can expand on the standard guidelines by Department of Social Development.
Okay, before maybe you respond to that one, I think it's Honorable Piri, Honorable Shong, who was raising an issue that the investigation that you've done, it's on Vodacom. Yeah. But I think what we'll want to see as a portfolio committee, it's for you to do it in other big companies, Chair. Yes, Vodacom is big, but also I think Honorable Shlomo was even expanding to say, please consider the sector of mining and agriculture. Yes. So that next time when you do your investigations, consider those sectors also, they are very much important for us.
Yes.
Okay, Chair.
Yes,
Continue.
thank you, Chair. Thank you very much, Chair. I fully agree with Honorable Hlongo that CGE should look at other sectors such as mining, industry, forestry, and meet to the committee that we did look at the mining sector, gender transformation in the mining sector. I was just trying to look at when was this done, and where the report is currently, Chair. But I think the mining sector, we have actually done the mining sector. It's not conclusive, Honorable Hlongo, but I think I do take the recommendation that we should also look at the forestry and farming. Those are big industries that remain untransformed. I think we will look at the mining report and look at when this investigation was done, but there is definitely an inroad that was done into the mining sector. And I fully agree that whilst we do this with other sectors such as Vodacom, such as Woolworths, we are also looking at other entities, private entities, in terms of looking at the status of gender transformation in these both small and big entities in the private sector, like we do with government. So we take that point, Honorable Hlongo, that we will look into the other industries such as farming, forestry, and other industries that haven't been explored in the next coming financial years. Chair, on the issue of minimum standards for victims of gender-based violence or victims of crimes. Chair, yes, we have engaged the Department of Social Development in terms of minimum standards that are there for services rendered in the shelters that are funded by the Department of Social Development. And Chair, I just want to mention in quick and in passing that one of those minimum standards, Chair, is the minimum standards for service delivery in victim empowerment and victims of crime, of violence. And this is a 2004 minimum standard or guideline. And this guideline basically is looking at the quality and experience of living in a shelter. It looks at the physical environment. It draws minimum standards around the security measures in the shelter. And it also looks at the residents' rights, which are victims in these shelters, and processes and procedures that are followed when residing in these shelters. Another minimum standard change in terms of policy strategy and minimum standards, the Department of Social Development has developed guidelines in terms of the provision of short-term interventions in the shelter, the persons who work in those shelters in terms of their training and capacity building needs. It looks at the intake sheets that should be standardized in all the shelters. It also looks at the accommodation, the types of accommodation for all types of victims, be it victims of gender-based violence in the form of women, children, members of the LGBTI, but it has a minimum guideline in terms of, how, victims should be accommodated, and it accommodates all types. It also looks at the standards in respect to security in the shelter, as well as the monitoring and oversight part. So those minimum standards are also looking at the monitoring and evaluation, the standard templates that are used to monitor and evaluate. Last but not least, Chair, when it comes to women and children, there is a 2013 to 2018 integrated program and action to address victims. And this is a DSD standardized program. People are admitted in the shelters. It looks at the programs that they should be able to access women in terms of psychosocial support, children in terms of access to school, whilst in the living in the shelter. And it also provides for responsibilities in terms of the department, and also looking at making sure that these minimum standards are implemented in the shelter. So, Chair, I think there is quite a variety of these standards and minimum guidelines and programs and policies that the department has developed. I think the only challenge that we looked at was the implementation of those policies, was the implementation of those minimum standards and guidelines in various shelters that we investigated. Because, Chair, you will find that whilst the minimum standards and guidelines are there, they
The chairperson got cut. CEO.
Honorable Chair, I think the chair may have gotten cut.
Yeah.
Yeah, because I was trying to look in the list. Maybe she's gotten cut. I'll get your guidance, Honorable Chair.
No, maybe you can continue so that when she comes back, then she can continue also. You can come in.
Okay.
Yeah.
Thank you, Honorable Chair. Starting at the top with the transformation project, there was a comment, I think is Honorable Piri. Actually, it's a comment that I would say we take note, because I think the comment was just as with Vodacom and Woolworths, the recommendations should have timelines as well as the progress follow-up. So in terms of the recommendations, and honorable members have seen there were timelines between 2020 and 21, but in terms of progress, because they submit information and we hold hearings, sometimes when they haven't adhered to the timelines, it's another follow-up situation for us where we go and demand those. So as I was presenting the transformation in public and private, I presented the findings, the recommendations, and progress as followed up as of 31 March 2021. So that's pretty much what it is, but we need to be strong on insisting on the achieving of timelines. The second comment was on shelters that are owned by private people that engage on illegal activities and not adhering to legislation. Maybe a comment one can make here is that when we conducted the shelter report and also the follow-up report, the initial shelter study and the follow-up report that I have just presented, the study was triggered by reports two cases that were reported by these entities to the CGE. So we followed up from that point of departure, and then we've also made findings, recommendations, and then we followed up the recommendations informed by the initial findings and recommendations. So what I would say is institutions like these shelters, and this might be more prominent in the country, we don't know. We did not look at this in terms of our investigative questions. We were looking at specific recommendations, but I have made a note that we, as the CGE, we look, you know, how prominent this is. And I'm saying this as at this stage, just speculating how we can approach this, but we know the problem now, and how we take it going forward is something that we need to strategize as an institution.
You mean the issue of crime?
The issue of privately. Sorry, Honorable Chair. The issue of privately owned shelters.
Okay.
Yes. So it wasn't part of these particular recommendations that we were following up.
Okay, and the issue that I've raised?
Yeah, I started at the top, going down
with,
okay. With the comments I noted. And Honorable Sharif highlighted the issue of funding and transparency. And one of the presentations I made here, I think it's in one of the slides, I think from slide 90 going down, it talks about how the Department of Social Development have tried to address the issue of transparency. And one of the things they said they're doing is publishing information about some of the you know, the spending, funding allocations that is happening around budget allocation for shelters. They give an example of 200 social workers who were trained and who was placed where. So it's like one of those attempts, and this situation vary in different provinces. So it's not an umbrella situation. Some provinces don't have anything we picked up around this, and some do. But the National Department of Social Development is beginning to do something to try and be transparent around issues of allocations. The issue of LGBTIQA marginalization in shelters, I think it was Honorable Sharif who asked if there were specific incidences. In terms of our research, we picked up these issues from their the silence, so to speak, the blindness of the policies, the programs, the services provided to issues of, and it applies also to persons with disabilities. If there's no guideline that says this is how to treat people, and I note the chair's comment, but in terms of following up the specific recommendations and what we were finding, it's their policies, their interventions that don't discriminate. It treats issues as if all is equal, the playing field is level, and that's where the danger is when it comes to mainstreaming designated groups. So it's not specific incidences. Just to respond to that, where the National Department of Health is in terms of the NSP and GBVF framework, as this study, I'm looking at the presentation. I don't think there was a specific question in terms of progress, and I don't know if I'm allowed. Actually, I don't think I should speculate in terms of what I know right now in terms of our involvement in this process. But I would just, I think safe to say, this particular study didn't focus on progress in that regard. The issue of SAPS waiting for the UN entity and COVID-19 as a hindrance, actually, it's one of those that, as I was presenting, I was thinking exactly what Honorable Sharif, you were saying. But again, as I was presenting, I kept highlighting some areas and say these kinds of findings, whether it's from the initial study, and this pretty much applies to both presentations, whether it's from the beginning or the progress, these are the areas that says to us, we must keep following up. But I also mentioned that as the CGE in this follow-up, we have a defined role. And this is where I become encouraged when, as different entities, we bearing different duties, when we collaborate, like your NPA SAPS collaborations that were highlighted in some of these studies, because no one entity can hold all these entities to account. So this is where we highlight and say this area is critical. How can we assist with the CGE, go beyond our mandate and provide support, for instance, for these entities to develop sexual harassment policies, for these entities to be capacitated when it comes to issues of substantive issues of gender. So this is where you need multi-stakeholder interventions because one entity cannot address all these issues. But as I have said, Honorable Chair and Honorable Members and my commissioners, for me, in terms of the CGE's follow-up, the two reports that were presented, they presented initial findings, recommendations, and progress. And I think for us, like I said, what was encouraging is that at some level, the picture is gloomy. At some level, it looks good because there are some initiatives in response to the recommendations. The issue the Honorable Chair raised around the issues of let me say young people, because if they are entering matric. Again, this particular study, when I looked at the report, this particular issue is not something that, you know, hit you in the face. And again, like the issue of privately owned shelters, I think these are some of the areas that as we do follow-ups, we need to begin to explore. So for us, it's like as we present, we discover other things that honorable members are picking up out there in the communities, and it's for us to delve further to see what is happening. That's why I was saying, for all we know, it could be prevalent in the country, but obviously let me not be, you know, push it and exaggerate, so to speak. So this is one of the areas, Honorable Chair, that I don't want to give comments that are not informed by anything that we have investigated. So we're noting it to look at it as we continue. It's a good thing because we are at planning stage now. So some of these are things that we will consider as we and prioritize as we plan towards the future. I think Honorable Chair also asked, we're talking about slow transformation in the public and private sector. What are we doing about it? I think for the CGE, maybe we need to intensify, as I said, following up on the implementation of our recommendations as we have done with these studies, and I know going forward we have those targets in our new APP. So we're continuing this work, and I think that multi-stakeholder interventions consisting of different duty bearers becomes key here, so that we reveal, we reveal, and then we all intervene as per our mandates. Bear with me, Honorable Chair, I'm looking at the next notes. Okay, I've responded to that. Oh, the funding of the Department of Social Development, whether we reported about the review of the policy being submitted to us, whether the allocations are actually benefiting the intended beneficiaries and so forth. And again, honorable members, these are some of those questions that when we monitor going forward, maybe that is an aspect now of delving further. And I sort of like indicated as I was presenting that these are some of the things that we need to delve further. So yes, as we were monitoring, we were investigating as per our recommendations, we got what we asked for, but how effective is it? It's a question now that perhaps as we monitor going forward, we begin to ask, because the questions will escalate depending on the responses of the implementing agents to our recommendations. I think the chair has spoken to the issue of investigating other sectors. What I can add in terms of, the chair mentioned the mining sector. I have seen a lot of reports in the CGE that has a lot of private companies and other public sector entities. What comes to head, the IOFNBs, your document warehouse, many. So we haven't covered each and every sector. But I think as we are looking, the idea is that hopefully one day we will cover all the sectors, but we do diversify, especially because some of our investigations are informed by complaints that come from those sectors. So that's how sometimes we are able to diversify. So I'm glad that most of our reports are in the website. Even the mining investigation report is in the website. I think I've responded to the question in terms of follow-up, because what I'm presenting, what I've presented in these two reports is following up and progress on previous recommendations, which have provided potential for further follow-up. And some of those questions we have noted where we didn't ask the questions in the previous follow-up that we have done. Honorable Chair, I think I've addressed all the comments, but if by any chance I left.
Did you respond to Masondo?
Honorable Masondo, I have Honorable Piri Sharif. Honorable Chair, I don't think so. Through you, Honorable Chair, if I may be reminded of the question, I'm sorry.
Yeah, Honorable Masondo, are you here? Masondo?
Yes, Chair.
Yeah, can you repeat your questions?
Yes, in question number 1, I just said what progress has been made since the CGE last presented to the committee on this report, the first report. What challenges has the CGE experienced in the development of the report and with the implementation of the recommendations? What has the CGE proposed to Vodacom in its bid to create employment policies that are gender neutral? In terms of COPTA, the report noted that The department failed to demonstrate commitment to transformation in its practices. The department submitted that due to constraints in the compensation of employees' budget, is it unable to meet government-wise transformation targets by utilizing the available vacant posts? How is this justifiable? That was the questions, Chair.
Okay.
Thanks, Honorable Chair, and my apologies, Honorable Masondo. I think I was taking other notes when I missed your questions because as you say them, I remember. In terms of progress since the first report that was presented to the committee, the current report, when we look at progress, it looks at it includes follow-up that has been done up to March 2021. So the new reports that we are releasing for 2021-22, bear with me, I don't want to confuse the years. We'll have a comprehensive report on that, but for progress, we included them in this presentation because the initial report is the one that was done in 2019-20. So the progress report is in the presentation and the final reports will be printed as usual at the end of the year. The issue of COGTA, Honorable Masondo, I can say in relation to the question about the challenges we experience in terms of the implementation of our recommendations, that response from COGTA maybe is one of the classic challenges. And when we look at the COGTA report, basically one can say of the 4 entities from this report, the 3 responded fairly well, except for COGTA. So, which is with and we presented this report to the Portfolio Committee on Employment and Labor, and of course they had their own recommendation. But we pretty much acknowledge that COGTA need some kind of support. Maybe yes, the budget is not accommodative, but as the CGE, we have seen that there are departments that achieve more with less. So we have that limitation in terms of challenges, which I usually provide, that sometimes we get information, as I have presented with the shelters report, where there were untruths, so to speak, provided. And as investigations, one can say even as research, we need to be critical to ensure that our research findings are valid. So that is one of the challenges where we have to go back, interrogate issues based on our initial questions to try and get to the truth. And though the truth 100% can never be guaranteed, but you manage to get a picture. And when I present, I sometimes cite findings from 20 years ago, just to show that the information is valid because the findings are still the same until today. So it's those kind of things that one has to touch and go as we try to deal with these challenges when we do our investigations with entities. In terms of Vodacom's gender policy, I think, and bear with me, Honorable Masondo, because I'm trying to remind myself from the presentation itself, but I think they had responded in terms of policy. And the question I had asked there is, some of these entities need support to mainstream substantive issues. If you look at Vodacom's interventions, and they are the most responsive entity in this investigation, their interventions are pretty much innovative. They have slogans, they use all kinds of platforms to respond to some of the recommendations. But I still say when it comes to policy content, you know, someone in one of the departments said, I think it's Woolworths, who said they got an expert to come and assist. So maybe that is one of the recommendations we need to give to Vodacom if we haven't already, because I can't remember all the recommendations, to say get an expert to come in and do this, because even the CGE doesn't have the capacity to provide this, the technical support to the entities that we are investigating or monitoring. Honorable Masondo, I hope I have responded to the questions.
What did you answer the one of BEE CO?
The one of, sorry, ma'am.
BEE compliance.
BEE compliance.
Yeah, I think she asked what was COFTA compliance insofar as BEE is concerned in issuing of tenders and outsourcing work.
Ah, oh, sorry, ma'am. Yes. Hey, I thought I wrote fast, but obviously not. There was, and this is the section as I was presenting, I think I made a comment. What remains is to verify if what is said is happening, because I think that area of procurement and reaching remote areas, instead of having them settle for the top for 50,000 as far as procurement is concerned, that for me is the nerve of transformation, economic transformation. And there is a statement, I may not find the particular slide, but there is a statement that was made there that they have ensured that they reach rural communities. They made sure through decentralization of procurement processes that they reach the people, you know, local sourcing of services and so forth. So there is a statement in response to that. But I think from where I'm sitting, perhaps I would say, speaking for the CGE, one needs to see the ingredients of that, because I have seen it before. It's easy to say, and this is the difficult area to actually deliberately target people who need to provide these services. I've heard things like, oh, they can't provide this. Only white industries are competent to provide these industries. Only men are competent to provide these industries. So women, especially in rural areas, are restricted to catering, for instance. So the question is, what are we going to do about it? Are we going to let the status quo prevail? And when this question, I'm not only asking to the CGE, I'm asking to the whole country, all duty bearers. What are we going to do about it? Are we going to let the status quo stay, or are we going to change this picture? So, Honorable Chair, I'm sorry to also omit that question, but it's one of the key questions that the response is not satisfactory, if I were to put it that way.
Okay, thank you very much, CEO. If there are no further questions from honorable members, it's okay. That means we are done. Is the chairperson back?
Yes, Chair, I'm back. I'm back,
Okay.
Chair.
All right. You can continue, Chair, where you left.
Yeah, Chair, really my apologies. I've actually put my apology on the chat box. I've switched on to the next gadget. Chairperson, I was still on the, I think, guidelines, Chair, overall. We will share the guidelines, the DSD guidelines, Chair, that I was referring to, all those to 2013, 2008, all the standard guidelines that they shared with us, Chair. But I was also saying that the implementation of those guidelines in all the DSD funded and partially funded shelters, Chair, is not the same. I think that's what we picked up, Chair, but we will share those guidelines so that I don't waste time on the guidelines. Chair, I also indicated that we did go into the mining sector. We did some investigation there in as so far as gender transformation is concerned. And I did acknowledge that Honorable Shongo, we will definitely in the next financial years, and according to our planning processes, we will expand our scope and look at the other industries such as forestry and farming, where really transformation is taking place, where it's very slow. I think CEO, when I joined, was responding to other questions, Chair, and I'm not too sure whether I've missed any question, Chair. But if I've missed any, Chair, we can make a follow-up and look at submitting any written information on behalf of CGE. Chairperson, I think as we continue to engage SAPs, we will raise these concerns that the portfolio committee has engaged or has engaged us on. And I am quite excited that we will also together as the portfolio committee and the gender commission, we will be going out to observe and do site visits with the SAPs. And I think the concerns that honorable members have raised, we will then be able to raise those questions together, Chairperson, as well. And Chair, if there is nothing that I've left out, I just want to apologize on behalf of the Chair. I think she has boarded now, and I just want to, on behalf of the Commission, really thank the Portfolio Committee for inviting us and presenting the two most important reports. I think the agreement, Chair, is that we have deferred the report on the termination of pregnancy to the next meeting, Chair, and we're looking forward to presenting that report. Thank you very much from our side.
Thank you very much, Chairperson and Commissioners and CEO. Thank you for coming to our Portfolio Committee so that we can be able to move forward with the other justice. It's not that we just ourselves time our minds on what is presented before us. So what happened, Kashifa, it took me because it's not my own making, it's technology. You know, technology does its own things, and the network problem, I think that is affecting each and every one of you in this meeting. It also affects, it doesn't care whether we are chairing the meeting or not, it just distracts you. I was saying, Chair, thank you very much, and we will make follow-ups also when we do our oversight visits on matters that you have raised, issues that you have raised in the report, and see whether the recommendations that you have made are being implemented, and we'll also give you feedback. And I'm sure even our researchers are writing down some of the responses that you gave us. And then when they were preparing our document for the oversight visits, they will also include that in that package so that you can see whether there's progress or no progress. But I think the issue of private sector, it's an issue that has to be taken very seriously. And you must not be afraid to go to their companies. You need to go, because that part, when it's not transformed, that means our people are not going to benefit, especially people who are going to be affected. It's women and persons with disabilities. And we are looking forward to in other research that you're going to do as CGE, and the legislation that we spoke about in the previous meetings. I think we're looking forward so that this term must not, and this administration or this term, it must not end before we conclude on that one. But thank you very much. We'll see you next week, Wednesday. If there are changes, you must inform us on time, Chairperson. But at least I think we've dealt with most of your reports, and it's only, how many that are left? It's only 2, if I'm not mistaken. Nelisa?
It's 3, Chair.
Oh, it's 3.
Including, yes, Chair.
And the termination of pregnancy, okay. So we'll see you next week, Chair. But thank you very much, honorable members, and those that were affected by network. Our apologies. There's nothing we can do. The meeting is adjourned. If there's no announcement, Nelly, the meeting is adjourned.
Thank you, Chair.
No, Chair.
Okay.
Announcement.
Thank you, Chair. See you later.
All right.
Thank you.
Thank you, goodbye.
Bye.
Bye, Chair.